harder, you won't hurt the baby, I promise. That is excellent. That's like the first stop.
You got it. Good job, son.
Listen, you gotta help me more often. You know how hard I have to work to find it sometimes? Alright, so it's time.
Hey guys, welcome back to our channel. We are at episode 6 in our pregnancy expectancy series. And last week we spoke about loving yourself in general and especially loving yourself when things are changing and things don't look the same anymore. And we're talking about pregnancy and we're here sharing our experience with you. And then my husband is gonna pop on in the video. Hi babe.
Hi. Hey folks, greetings. Welcome back. Good to be with you again. And we thank you for following. We thank you for the comments. We thank you for the prayers, for all the congratulatory messages. And thank you for taking this journey with us. Remember, if you haven't yet subscribed, hit that subscribe button. Hit the notification bell over to the right of your YouTube app. And leave a comment, leave a like, give a share. Let's spread the good stuff. So we're going to continue today in episode 6, focusing on loving yourself, appreciating yourself, building your self-worth in life in general, and for those who are on this journey of pregnancy and those who hope to get there, things to look out for, things to be mindful of. So last week we spoke about just the importance of loving yourself through changes, grasping those changes, working with the fact that there are things in life that change and we have no control over them. And it is important to adjust our attitude, to accept what we can't change, love ourselves intrinsically, that our self-worth must come from within, grounded in the fact that we are made in God's image and God loves us with an everlasting love. This week, we want to share another aspect of loving yourself, and that is the importance of eating nutritiously and the importance of exercise, regular exercise, as two simple but very important part of habits that will generate greater self-love and appreciation. Stick with us. We'll be right back. But before we continue, we want to just take a moment just to say thanks and introduce to you two of our partners on this journey. And we're going to start firstly with the colorful box.
So let me just back up a bit, babe. He said eating nutritiously and exercise. We all know that. In pregnancy, babe, it doesn't work like that all the time, right?
Well, I mean, with the cravings and all, but the important thing is, despite the cravings,
trust me,
and despite the increased hunger.
Oh my goodness, the increased hunger is real, like really real. But anyways, let's get back on track. We'll go back to that a little bit later. So, we all know that Colgate is celebrating Oral Health Month. So October.
Is it just Colgate or is it?
It's Oral Health Month, but it's
in
Colgate.
General.
Yeah, so
Okay.
I am talking about Colgate.
Okay, Colgate is participating
yeah,
in
it's
celebrating
Oral Health
Oral
Month.
Health Month. It is Oral Health Month. Did you know that October, every year October is marked as Oral Health Month?
And Colgate is awesome sauce. And look what I got from Colgate. Look what I got from Colgate. Why am I bringing this up tonight? Alright, so it is very important when you are pregnant and in general to have a healthy oral hygiene, that is seeing your hygienist or your dentist at least twice per year. And especially when you're pregnant, it's important to see your dentist and have a cleaning and consultancy.
Yeah, I didn't know that.
Right, in your second trimester. And so we went and we got our teeth cleaned And the doctor commended me that yes, it's important to come and get your cleaning done when you're pregnant because it prevents pregnancy gingivitis. I did not know this. I always brush my teeth. I always go to the dentist, but it's especially important when you're pregnant, in your second trimester, to see your dentist to get your teeth cleaned so that you can prevent preterm labor. Two things I know: preterm labor and pregnancy gingivitis. And Colgate has the good stuff for all of this. So let's go. So first off, we have the toothpaste. Brush your teeth what? 2 times, 3 times per day? 3 times per day. 3 times per day.
At least 2 times.
At least 2. And then you have the toothbrush. They have so many varieties. This is a 360 floss stick, and they have so much more. They're awesome, very soft, and it reaches to the back, and it gets everywhere. And then most important, you gotta rinse. You gotta rinse after you've eaten. It's very important to use your mouthwash. So thank you to Colgate, and I got this cute little goodie bag to store, my little cute stuff in. So yeah, that's it from Colgate.
Yeah, and the mouthwash, it's a good way to introduce the little ones to oral health. So in our house, Zach, he wants to boss the mouthwash.
He wants his own floss.
So yeah,
he wants his own toothpaste, and he wants his own mouthwash. And guess what? They have to be Colgate. Like he legit knows nothing else. Mommy, I want my Colgate toothbrush. I want my Colgate toothpaste. Okay, I give him his Minion brush, his toothpaste, and his mouthwash. So he's all Colgated.
Right. So ladies, remember, good oral health consistently, important part of taking care of you, loving yourself, but also we learned that during the second trimester, it is actually very, very important to check with your dentist to make sure that everything is okay there. You don't want to get the pregnancy-induced gingivitis, nor to have anything else happening in there that can, as Latoya said, actually lead to
preterm labor. What's preterm labor? Meaning having your baby before it's due.
Yeah.
And we all know the complications with that. You have to spend more money for the baby to be in the NICU, and we don't want that to happen. So we want to have a full-term baby, and so we are doing everything that we can. And what we don't know, our doctors will tell us, and we try to follow suit and follow what he or she says. So we are doing just that so far. We're taking all the recommendations, and we are just putting into practice what our doctor, is saying. So we're up to par, and it's coming closer.
Yeah, it's what? Week number 24? Going into 25?
That's right.
So it's 6 months, guys. Can you 6 months?
We're at the 6-month mark. 3 more to go. But you have, 30? Maybe we counted it. We have 30 days left for the gender reveal.
Yeah.
So
somewhere there.
Yeah.
30 little bit. December 5th. That's the date.
For the gender reveal.
One day after her birthday.
Right.
Her birthday is December 4th, and then the next day, the gender reveal. So it's getting very, very close.
Very close. And then remember, I had posted a short video on my WhatsApp saying that our doctor might have exposed the gender. How did that happen? Let me tell you how it happened. So we have 2 doctors, as we shared. Well, we have 2 doctors. Gonna be 3 soon. 2 doctors. So the male did the anatomy scan, where
brother and sister.
Right, where we get to see what's happening with different parts of the body and the developing parts, the brain, the heart, how tall the baby is, and just making sure that everything is okay, and also the gender. So my sister, she came to this scan with me. Teddy was not there. And when it was time for the private part, I had to turn my head away for my sister to see what is there, if it's dangling or if it's flat. And so,
What a
and
way to
so,
put it.
and so,
Dangling.
yeah, so the doctor told her what it was. And as I said, she is my baby sister, is the only one that knows the gender of our baby. I don't know if I am carefree or what, but I'm really with the tide. I'm good with it. But then last week we went to see the sister of the door, and I think she might have spilled the bean, but the way how the conversation started and ended is as if she caught up with herself. I heard her saying something, but I'm not going to repeat it. I did not dwell on it. She said something, but then she fixed it, and so I'm gonna leave it at that. But I might know, baby. I might know.
Well, I think I know intuitively.
Tell them what you think it is.
I usually have a way of knowing this. So
Tell them.
I really have a feeling that we're gonna be having. No, I'm not gonna say. I'll let you know
He
on
thinks he knows.
on the 5th
He thinks he
or
knows.
after whether I was correct. Alright? Yeah. So that's that. Alright, so we said at the beginning, so we mentioned the matter of eating, yeah, managing your nutrition during the pregnancy.
I try.
Yeah, we know
try.
it's a struggle.
I did it before. I mean, I can eat healthy. I know what to eat healthy. I know how to be skinny. I know how to be fit. But now, I think I'm having more control now. But before, even if I was a diet guru, I don't think it would work now. And I'm not lifting weights anymore. I'm doing light walking,
Right.
light stretching.
Keep the exercise routine going, or even if you didn't have one before, it's really important.
And it's not too late to start.
Never too late to start.
Not too late to start. You can start. Not too late.
Just giving in to the urge to eat can actually lead to
Gestational diabetes. Gestational diabetes.
Gestational diabetes.
And so now I have to be, and I mean, our doctors told us the last time, I know, like, going forward now we have to look out for different signs like swelling of the hands and face and feet and, pain certain places, just to rule out preeclampsia. We all know what preeclampsia. I need to read up on it some more before I tell you what it is. I know what it is, but to word it right now, I may get myself in a little bit of trouble. So,
Yeah, so just
I'll leave
Google it
that
in
for
the
now.
meantime.
Right, but I think
Yeah.
it's almost the same as gestational diabetes. I think it's synonymous.
Yeah,
I can almost
they're
sure
related.
it is
They're
synonymous,
related. And then there's a high blood pressure aspect
So,
of it.
and
as
we
well.
have that part under control
Yeah.
as
Thank
is.
God. Thank
Yes.
God. Yeah.
So far, so that was a major concern, the hypertension, but we have that under control. God has given these doctors great insight and technology and medicine. So we are working with them. And talk about medicine, babe. I think we should talk about the big V. Next series, not now.
Anyway, next episode.
Next episode season. Can you imagine? Yeah, next season.
Yeah.
We're going to be having lots of seasons, right?
Yeah.
So I say big V because if I'm going to say I believe in the medicine, we have to talk about right.
Yeah, we have
So
to
we
talk
have
about
to
the
talk
big
about the big V.
Yeah, but that's coming up.
It's
All
coming
right.
up. We
So,
have to. Yeah. I hope we have to talk about the big V.
But remember, takeaway from today.
Yes.
The importance of oral hygiene
Yes.
during pregnancy and managing the consumption of food, especially the sugary foods, the high
Fried
carb
foods.
foods, the fried foods, and so on.
Mm-hmm.
Gestational diabetes, a big challenge. Get the exercise in, and it's all part of loving yourself. The habits that will help us to increase our self-love and our self-worth. All right, so we told you about Colgate. The other partner, the other sponsor we want to share with you. Colgate.
Right.
Colgate. That's how I grew up pronouncing Colgate. We're not hearing about no Colgate or Colgate. The other partner is our online beauty store.
Yay!
Great prices, all brand name products, over 400 different brand name beauty products from Revlon, you name it. All the big brands, the big brand authentic colognes, just like basically everything beauty at tremendous prices, in some cases wholesale prices. Follow the store online on IG at Avid Beauty Loft, AvidBeautyLoft, and the website to fill your cart and send it across to your favorite favorite courier, shipper, your mail packer, ship me, whatever. Avidbeautyloft.store. Avidbeautyloft.store. Right, so those are our partners, and we look forward to hanging out with you, you hanging out with us next time. See you soon, somewhere on the big screen. Remember, subscribe, like, share, comment. Peace out, stay safe. Until next time.
Have a great week, guys.
One love. Go be your best.
We know you're the lion. We know. And we may be having another cub or lioness.